Hello friends and my dear students. Once again, offline sessions has taken U-turn towards online sessions. So let us proceed with e-learning practical session on essential medicines. This practical covers two competencies. Competency PH 3.7 is prepare a list of essential medicines for a healthcare facility. With specific learning objective is at the end of this practical session, the phase 2 MBBS student should be able to prepare a list of essential medicines for a given healthcare facility. And another competency is competency PH 3.8. Communicate effectively with a patient on proper use of prescribed medication or device. It has specific learning objective of at the end of this session, student should be able to communicate effectively with patient on proper use of prescribed medication or device. This communication competency is already being covered during practical number 7. So in this practical, we will focus on essential medicines. So let us begin with an overview of this practical. Here we will discuss definition of essential medicines, criteria for selecting essential medicines, WHO model list of essential medicine, national list of essential medicine and state level essential medicine list. And at last we will discuss in detail regarding how to prepare an essential medicine list for given healthcare facility. So first of all we will discuss definition. As per WHO, essential medicines are those that satisfy the priority healthcare needs of majority of the population. Essential medicine list is generally framed on the basis of prevalence of disease, efficacy and safety of drug and relative cost effectiveness. So in short, essential medicines are intended to be available in functioning health system at all times, in adequate amounts, in the appropriate dosage forms, with assured quality and at a price the individual and the community can afford. Next is criteria for selection of essential drugs. These criteria are as per WHO guidelines. First is efficacy and safety of drugs. Only medicines for which sound and adequate evidence of efficacy and safety in variety of settings is available should be selected. Availability of scientific data from controlled clinical trials or epidemiological studies should be present. Quality. Each medicine selected must be available in a form in which adequate quality, including bioavailability, can be ensured. International non-proprietary name (INN) or generic name of drug should be used. Cost of treatment. Most important part. Relative cost effectiveness is a major consideration for choosing medicines within the same therapeutic category. In comparisons between medicine, the total cost of treatment, not only the unit cost of medicine, must be considered and be compared with its efficacy. Availability. Drugs for which reliable local manufacturing facilities exist should be selected. Obviously, ease of administration is important consideration. Better acceptability and patient compliance should be kept in mind. Relevance to diseases and the level of training of health workers at different levels of healthcare should be given priority. Most essential medicines should be formulated as single compounds. Fixed dose combination products are selected only when the combination has a proven advantage in therapeutic effect, safety, adherence, or in decreasing emergence of drug resistance as in chronic diseases like tuberculosis, HIV, or in malaria. If we see history of the essential medicine list, then Tanzania was the first country in the world to frame its essential medicine list in year 1970. Then World Health Assembly requested WHO to assist member states in choosing essential medicines with assured quality and at reasonable cost in 1975. And the first WHO model list of essential medicines was published in 1977 with 208 medications, and WHO updates this list every 2 yearly. There is a separate list for children up to 12 years of age known as WHO Model List of Essential Medicines for Children that was created in 2007 in October month. The latest versions are 21st WHO Essential Medicine List that contains nearly 460 medication and 7 WHO Essential Medicine List for the children that was updated in March 2019. This website reference is given for this WHO Essential Medicine List. And this model list provides us a guide for the development of national and institutional essential medicine list. Next is WHO Model List of Essential Medicines contains core list and complementary list. Now, what core list contains? It presents a list of minimum medicines needed for a basic healthcare system that list the most efficacious, safe and cost-effective medicines for priority conditions. Now, how these priority conditions are selected? These conditions are selected on the basis of current and estimated future public health relevance and a potential for safe and cost-effective treatment. Another list is complementary list. It presents essential medicines for priority diseases for which specialized diagnostic or monitoring facilities or specialist medical care or specialist training are needed. Updation of essential medicine list, as we have discussed before. Why there is a need to have updation in essential medicine list? Every essential medicine list must be flexible to accommodate new medicines or any new information on established medicines. So, this revision should be done every 2 yearly because, as we all know, a lot of advances occur in our medicine therapy and to meet the needs of practice in light of experience gained. Previously, we have discussed about WHO Essential Medicine List. Now we will see in detail National List of Essential Medicine. The first National List of Essential Medicines was released by Ministry of Health and Family Welfare, Government of India in year 1996, comprising of 279 medicines. Revisions were made in 2003 that contains 354 medicines, then in 2011 that contains 348 medicines, and the latest revision was made in 2015 that contains 376 medicines. The vision of Ministry of Health Government of India is to provide 50 essential generic medicine free of cost from birth to death to all Indians across the nation. That includes traditional treatments for pain, infection, diabetes or hypertension, etc. The National List of Essential Medicine 2015. that is the latest one, has been prepared adhering to the basic principles of efficacy, safety, cost effectiveness, and consideration of diseases as public health problems in India. You can say this list is as best fit list. As we have talked about that the latest version contains 376 medicines, and this is website reference for this latest national list of essential medicine. Based on that you can prepare answer of your exercises. Now, levels of healthcare in national list of essential medicine. Now the medicines are listed with reference to the levels of healthcare, whether it is primary, secondary or tertiary, because the treatment facilities, training, experience and availability of healthcare personnel differ at these different levels. Formulation of certain medicines are listed at different levels, but as item they are counted as one. Out of total 376 medicines, 209 medicines listed for all level of healthcare, primary, secondary and tertiary. 115 medicines for secondary and tertiary levels, and 79 medicines are listed for tertiary level only. Now, apparent mismatch in the number of medicines is due to different salt form or formulation of same drug is taken as one or separate item. For an example, lyophilized and liquid formulation of anti-snake venom are taken as separate item, whereas isosorbide mononitrate and isosorbide dinitrate are taken as one item. Due to this, some apparent mismatch is seen in number of medications. Now, what is the purpose of making this type of national list of essential medicines? To guide safe and effective treatment of priority disease condition of population, to promote rational use of medicines, to optimize the available health resources of a country, and it provides us a guiding document to prepare a list of essential medicine at state level, for procurement and supply of medicine in public sector, reimbursement purpose of cost of medicine by organization as well as for insurance companies, and to identify the must-know domain for the teaching and training of healthcare professionals. Now, the important thing regarding national list of essential medicine that is not given in your channel, just remember, Government of India has started the process of revising and updating the national list of essential medicine. Now, SNCM, that stands for Standing National Committee on Medicine, is constituted by Health Ministry to revise national list of essential medicine every few years. Now, first stakeholders meeting with the SNCM. It was conducted in last week of July 2019 to revise national list of essential medicine. This SNCM with Health Ministry plans to shortlist some hygienic products like soap, adult diapers, sanitary napkins, floor disinfectant, hospital handlers, etc. They are also looking on price control part of the products in National List of Essential Medicine under DPCO 2013. DPCO stands for Drug Price Control Orders. Now, what is this DPCO 2013 Act? DPCO 2013, it is an order issued by NPPA, that is National Pharmaceutical Pricing Authority, under Section 3 of Essential Commodity Act 1955. This NPPA is an organization of Government of India that fixes or revises the prices of control blood drugs and their formulation, including those mentioned under this NLEM. Violation of this DPCO 2013 is punishable offence under Section 7 of Essential Commodity Act 1955, and here the punishment is imprisonment for a term of not less than 3 months, and it may extend up to 7 years. Next is state level essential medicine list, means Gujarat Essential Medicine List. It comes under GMSCL, Gujarat Medical Services Corporation Limited, Gandhinagar, Government of Gujarat. Every year this list is being updated. The latest one is 2020-2021 Gujarat Essential Medicine List. It contains 219 tablets and capsules, 190 injections, and 126 miscellaneous like syrup, cream drops, suspension, nebulizer solution, etc. This is included in this latest list. This is website reference where this list is given. In this website reference, everything is mentioned in detail regarding which areas are to be covered in primary, secondary and tertiary healthcare systems. Now, most important for you people is how to prepare an essential medicine list. For example, prepare an essential medicine list for an outpatient department of primary healthcare center located at outskirts of Jamnagar city with daily turnover of 100 patients at OPD. Now, steps to prepare essential medicine list. First, you find out the location and level of healthcare. Okay, here it is OPD based and primary healthcare centers at outskirts of Jamnagar city, semi-urban area. Second thing you will have to do, number of patients attending OPD. Here it is mentioned, average 100 patients attend OPD per day. Third thing you need to do is, you will have to rule out common conditions you observe at healthcare center. Suppose in emergency, what you see? Cut wounds, insect bite, anaphylactic shock, animal bite, febrile convulsions, status epilepticus, chest pain and poisoning cases. Which acute condition you note down, like fever, vomiting, diarrhea means gastroenteritis, severe dehydration, abdominal colicky pain, etc. Which chronic conditions you daily see at this OPD level, like hypertension, diabetes, ischemic heart disease, epilepsy, tuberculosis, anemia, etc. After that, by keeping in mind these all things, you will have to prepare a list of essential medicine for this given diseases from essential medicine list references, and this prepared list of essential medicine for this given exercise is given in your journal. You can take it as a reference example for making answer of your exercises. So in brief, consider following points by formulating an essential medicine list. Here one trick is there. Each letter of essential has particular point to remember. E stands for essential medicine should be effective and economical. S stands for safe. Another S, it should be a single drug formulation. E, while manufacturing essential medicine, environmental conditions should be considered, and it is needed by majority of the population. T stands for time. It should be available in adequate amount all times and in proper dosage. A. Aim to use limited financial resources. That is important one. While manufacturing essential medicines, it should be by using limited financial resources. And last but not least is L. List of essential drugs should be prepared locally by following model list of WHO or national list of essential medicine. So in brief, I introduce you this topic of essential medicines and various list of essential medicines as per WHO National List of Essential Medicine at India and state level essential medicine list. Now your turn of performing exercises. First exercise is prepare essential medicine list for given healthcare facility and communicate effectively on proper use of prescribed medication for asthma, anemia and diarrhea. And second, how will you communicate for written prescription of practical number 12 and 14? But in this practical, you will have to just prepare an essential medicine list. Communication part we have already discussed during role play sessions in practical number 7. So here, role number 1 to 6b. You prepare and write an essential medicine list for asthma for tertiary healthcare center located at Ahmedabad with daily turnover of 300 patients. Rule number 61 to 120. You prepare and write an essential medicine list for anemia for tertiary healthcare center at Ahmedabad. And rule number 121 onwards, prepare and write an essential medicine list for diarrhea for tertiary healthcare system at Ahmedabad. Okay, and this is reference material. You can download it and prepare a essential medicine list for given condition to you for given healthcare system. Thank you very much for listening. Stay home, stay safe, take care.